So on this slide, we'll talk about preconception care. Also, recommendation is that the women with pre-existing diabetes who are planning a pregnancy should ideally be managed beginning in preconception in multidisciplinary clinic, including an endocrinologist, maternal fetal medicine specialist, and registered dietitian, and diabetes care educator, if available. In addition to focus attention to achieving glycemic target standard preconception should be augmented with extra focus on nutrition and diabetes education and screening for diabetes comorbidities and complications. Women with pre-existing type 1 and type 2 diabetes who are planning pregnancy or who have become pregnant should be counseled on risk of the development and progression of diabetic retinopathy. So dilated eye examination should occur ideally before pregnancy or in the first trimester. And then patients should be monitored every trimester and for 1 year postpartum as indicated by the degree of retinopathy and as recommended by the eye care provider. In this slide, it shows, the checklist for preconceptions care of women with diabetes. So, here preconception education should be included as a comprehensive nutrition assessment, overweight, obesity, underweight, or meal planning, and correction of dietary nutritional deficiencies, caffeine intake, safe food preparation technique, and also lifestyle, comprehensive diabetes self-management education, counseling on diabetes pregnancy or current standards include natural history or insulin resistant in pregnancy, postpartum, preconceptions, and many recommendations. You can go through this slide. Also supplementation of folic acid, appropriate use of over-the-counter medication, and supplementation. So next slide, as we see here in this table, medical assessment and plan should include general evaluation of overall health, evaluation of diabetes and its comorbidities and complications, evaluation of gynecological and obstetrics history, review of the current medications and or during pregnancy. And screening should include diabetes, comorbidities including comprehensive foot examination, comprehensive ophthalmological exam, ECG, in women starting at the age of 35 years who have cardiac signs, symptoms, or risk factors, and if abnormal, further evaluation. Also lipid panels, serum creatinine, thyroid function tests, urine protein to creatinine ratio, look for anemia, genetic carrier status based on history for such disease like cystic fibrosis, sickle cell anemia, thalassemia, other if indicated, anti-sash disease, and also for infection disease, Neisseria gonorrhea or chlamydia, hepatitis C, HIV, pap smear, and syphilis. Also, we'll go for immunization history and include, if needed, to be given rubella, varicella, hepatitis B, influenza, and other if indicated. Preconception plan should include also nutritional and medication plan to achieve glycemic targets prior to conception. Also, contraceptive plan to prevent pregnancy until glycemic targets are achieved. Management plan for general health, gynecological concern, comorbid conditions or complication if present, including hypertension, nephropathy, retinopathy, and RH incompatibility and thyroid dysfunction. Special attention should be paid the review of the medication list for potential harmful drugs like ACE inhibitors and ARBs and statins.